Hi, this is Mrs. Roberts. We're doing AP Psychology 9.1 and 9.2. Question number 1. The field of developmental psychology would most likely address which of the following questions? The answer choice that we're looking for when we're trying to match for developmental psychology is something about the lifespan, how people change over time. The answer choice that best fits that selection would be D. So lifespan here. You'll notice that in A, this is just talking about helping people stop smoking, which is a habit or a behavior. So that would probably be behaviorism. What brain areas? That's going to be biology. Effectiveness of operant conditioning. That's really going to be like maybe cognitive sections of psychology. You'll notice it says cognitive abilities. That doesn't necessarily mean just how people think, but that's, again, over the lifespan is what makes this answer choice correct. And then E, medications. That is something that would affect someone's development, but it says which question would it most likely address. And so medications, which ones are best to treat anxious children, that's probably going to be biology again. Number 2, a researcher tests the problem-solving skills of 20 10-year-olds, 20 20-year-olds, and 20 30-year-old participants for a study on age and problem solving. What research method is the researcher using? You guys were asked to learn about 2 different types of studies or types of research methods on a study. So longitudinal and cross-sectional. To refresh your memory, longitudinal is basically studying a subject over a period of time. You might study someone whenever they're a baby and when they're a toddler. You have them come back when they are maybe a preschooler. That would be longitudinal, again, over time. Cross-sectional is going to be data from many age groups. You can collect these a little bit more quickly than you can longitudinal data sets. Social, cognitive, and developmental, those are not research methods that we've been asked about. And then sequential is a nice distracting question. If you know a lot about research methods, then you probably know that sequential research is basically a combination of longitudinal and cross-sectional design. That is not the correct answer. So again, the right answer here is cross-sectional. That's D. All right, number 3, the blank stage is the final stage of prenatal development lasting from 9 weeks after conception until birth. All right, you guys were asked to learn about 3 stages, the germinal stage, the embryonic stage, and the fetal stage. You'll notice that there are 2 that don't fit there. So zygotal, a zygote is actually what the fertilized egg is called in the germinal stage. And then the moro, that's a reflex that we'll look at a little later. So then you've got between germinal, embryonic, and fetal that you're choosing from. So this one is going to be really that first 2 weeks of development. Embryonic is going to last all the way until about 8 weeks. So in layman's terms, after the menstrual cycle has been missed twice. And then the fetal stage is 9 weeks all the way through conception. So it's quite long. That doesn't necessarily mean it is viable. So the age of viability for a fetus is 27 weeks. All right, number 4. Which of the following statements regarding the sex of a child is true? The correct answer here is the sex of a child is determined by the father's genetic contribution. To be specific, a female's egg and a male's sperm cells each have 23 chromosomes. At conception, an egg and a sperm unite to form the zygote, which now contains the full set of 23 pairs. So the 23rd chromosome determines a baby's sex. A genetic female's 23rd pair contains 2 chromosomes, an XX, so-called because of their shape. Because women only carry X chromosomes, the 23rd chromosome is the egg is in the egg is always an X. A genetic male's 23rd pair contains an X and a Y. Thus, the 23rd chromosome in the sperm is an X in about half the case and a Y in the other half. The Y chromosome contains a specific gene, which is the TDF gene that triggers male sexual development. There you are. All right, number 5, most prenatal influences on humans are genetic or hormonal in origin, except for teratogens. So this is the correct answer here. So I'm going to, this is just a basic, do you know this or not? I'm going to go ahead and turn this over to a glorious professor, Dr. Kristen Atchison. Okay, so what are those protogens? So just for your own information. Sorry about that misspelling situation. There we go. An agent or factor that causes malformations. So, what are things like that? It can include radiation, maternal infection, chemicals, drugs. That's what you're looking at. All right, number 6. Which of the following statements is most true about how a newborn senses function? All right, so most senses function normally, but sight develops slowly with experience. So that's going to be choice E. What we know about newborns is that when we're born, hearing is our dominant sense because we have such poor vision. We're born almost legally blind. You can see well about 8 to 12 inches in front of you, enough to get to your mom, to your kind of food source, but that's about it. Just to give you kind of a sense, this is from your textbook. This is at 1 month, this is at 3 months, and this is at 12 months, so 1 year of age. All right, number 7, when a newborn baby is sleeping, which reflex will be elicited by a sudden noise or touch? I asked you to learn about several different types of reflexes. The one that is correct here is the Moro reflex. When startled, a baby will fling his or her limbs out and then quickly retract them. This is why mothers swaddle to prevent this from waking their babies up. Another one of those reflexes is the Babinski reflex. It's whenever you put your finger on their foot and their toes spread out. It's also called the plantar reflex. So those two are the same. I also asked you to learn about the rooting reflex. This is when you touch on the cheek, a baby will turn his head to the side where he felt to this touch, and that's just to help them get to their mother's breast to nurse. And then lastly, grasping. If an object is placed into their palm or foot pad, they'll try to grasp it with their fingers or their toes. Now, I also asked you to learn about sucking. When an object is placed in the baby's mouth, an infant will suck on it, and that's a combination of rooting and sucking reflexes, and that helps babies eat. All right, number 8. Within a few days of birth, most infants are able to reproduce the facial expressions of an adult. Some theorists assert that this behavior is the product of a simple biologically based form of modeling. So within a week, or maybe even within a few days, newborns can reproduce these kinds of facial expressions. And by the time that babies are 9 months, if they can produce those models even from memory, almost a day later. And that's just kind of a memory there. All right, finally, number 9, Eli's beginning to sit up, assuming he is developing at a typical pace. How old is Eli? This question comes from your textbook. This is our nice little deal here. We've got months, and our question again was about Eli. And he is beginning to sit up. So that is right here, sits without support. And that happens between 4.5 and 8 months. So for Eli, we are going to choose 6 months here. Now, if I were to ask you something like standing alone easily, separate situation. All right. So make sure that you know this chart, that you know all the different kind of time periods. All right. And that's it.